Hello there, welcome again to yet another episode of Fit With Mithraas. So we are with Sasikala, and every week we see small house remedies on physiotherapy, right? On physiotherapy management, okay? So அதுவா நம்ம எப்படி வீட்டில் பண்ணிக்கலாம்னு. ஆனால் இதில் சொல்லிக் கொடுக்குறது எல்லாமே வந்து physiotherapy management தான். It is not medical advice, it's not clinical advice. So உங்களுக்கு ஏதாவது ப்ராப்ளம் இருந்தால் please consult with your doctor and then you can proceed further on. Alright. So what is that we are talking, Sashi? ஏற்கனவே நம்ம வந்து கீழ இருந்து பாதத்துல இருந்து நிறைய முடிச்சிட்டோம். நம்ம ஹிப் வரைக்கும் இப்போ பண்ணிருக்கோம் நம்ம.
Yes sir. So we done with osteoarthritis, other osteoarthritis, then related to that total knee replacement. And then we have done osteoarthritis of hip. So followed by we are going to see osteoarthritis of hip following the total hip replacement.
Total hip replacement, okay. So you're talking about total replacement, hip replacement.
Total
right?
hip replacement.
So what is that? Tell me more.
So total hip replacement எப்போ பண்ணுவோம்? So all that is like when the medication and physiotherapy management is not helping. Helping in the sense like after episodes of medication, after visiting or doing physiotherapy for a long time, so if the pain is still intolerable. So if the pain is still persisting, முடியல கீழே உட்கார முடியல, intolerable, uncontrollable. So in that case, the doctor will advise total hip replacement. அதாவது total hip replacement என்னன்னா, hip joint is a ball and socket variety. So ball is part of the long bone, that is thigh bone, and the socket is part of the pelvic bone. So when there is a connection that forms the hip joint. So in the articular surface erode ஆகி bone to bone contact வரதுனால there is so much of pain. So அந்த pain வந்து to erode the pain. So pain is the most factor. The patient is not able to move. So pain, for the pain relief, so for better mobility, to get the proper movement pattern. So for that the total hip replacement is advised.
So இப்போ என்ன டாக்டர் வந்து அதை ஆப்ரேட் பண்ணி முடிச்சதுக்கு அப்புறமேல் தான் அவங்க physiotherapy
Yes, the main role follows from the day one. So there is week based exercise protocol as I already mentioned for the knee. So like when there is a replacement or repair, whatever the procedure we do, the patient is done with any procedure, there is week based protocols which makes the program complete. So it is not like the joint is replaced, the patient can move about. So there is pain still, and how to overcome the pain and how to improve the range of motion. Range of motion na like கால் எவ்வளோ தூக்க முடியுது, எப்படி வைக்க முடியுது. We also give them functional training. First we start with bed mobility. So bedல இருந்து எப்படி எழுந்துக்கிறதுன்றதே it is a procedure.
So the first exercise உங்களுக்கு பெட்ல தான் ஆரம்பிக்கும்.
Yes. So the day one starts from the bed. So like there are circulatory exercises. So after the procedure the patient is bedridden for some time. So that time we give them circulatory exercises to improve the circulation, because there are chances to get DVT, that is deep vein thrombosis. So blood clot form achinaka, then if there is no any proper circulation, the blood clots, and if that is traveling to any part of the body, then the blockage will cause its own effect.
Okay.
So to avoid that, we start with all bed and exercises, then how to get out of the bed, and what are the do's and don'ts on the bed, and how to walk, and how to strengthen your muscles, how to improve the range. So all that we are going to see as week based protocol.
Okay. So how many weeks you suggest for that?
Minimum 6 weeks. So for better movement pattern, minimum 6 weeks of physiotherapy I would advise for total hip replacement.
Okay. So we're going to see further on the exercises, right?
Yes.
All right. So back to Sashi for the exercises.
So now I am going to demonstrate the bed end exercises. Also how to make the patient sit up and walk after the total hip replacement. So now this is going to be the position, like both the legs apart. So we always encourage a pillow in between the legs, and the operated leg, that is right side, has to be supported at the foot end so that there is no rotation either side. So the feet has to be straight so that the whole leg is straight, and the patient is bound to bed. So I'm just going to show how to start with basic isometric exercises, that is there will be muscle contraction but with no movement. So after doing all that, I'm going to make him sit up. So now it's going to be ankle movements. Ankle movement is a circulatory exercise to improve the blood flow and also to prevent the DVT. This we encourage minimum of 50 count every 2 hours. Yes. So next, as we have seen already in the previous episode, I am going to work on the front thigh muscle, that is quadriceps. It's isometric quadriceps. So up. So now press the knee down, hold for 10 seconds. Hold for 10. I'm going to show isometric quadriceps. So quadriceps is a major muscle and that is going to bring a lot of knee movement. So we are going, and that is originating from the hip. So I'm just going to show how to work it in a simple and effective manner. Now he is going to press the knee down, press down and hold for 5 seconds. So in this the knee will be pressed down, not necessarily the toes will come up, because we have to avoid the hyperextension, and there is contraction of the front thigh muscle. So count of 5, holding for 5 times. It's just a preparation to make the patient get out of the bed and to walk. Next, we are going to work on the gluteus maximus, that is the butt muscle. We have worked on the front part, side part, and now it's at the back. Now he is going to just press the bed with the help of butt muscle down. Just press the bed firmly with your butt. It's a downward pressure. Press and hold for 5 seconds. 5 seconds. Just a minimal pressure, just to ensure that every muscle is involved. Not necessarily it has to be a visible contraction. A very mild is what even possible for the real patient, because after the surgery the gluteus maximus, that the butt muscle is open and the procedure is done, so it will not be that easy as he does now. We have prepared his surgical side, thigh muscles, hip muscles. Now I am going to show how to get him out of the bed. So first I am going to do log roll, that is the wood log. It's a single piece. So like that I am just going to roll him for 5 times and then help him to sit up. So just hold my hand. Yes. So I am going to support the surgical side and just slowly roll. 1, 2, 3, 4, 5. This is the toughest form of exercise we do after the surgery. It's not going to be that fast as we have done now. It's a very slow paced exercise, because it's very tough to move the operated side. And after the log roll, now he is going to get up. So usually we have another support, usually we have another support staff or the fellow therapist to help him get out of the bed. So I need another support to raise his shoulders off the bed. So now he is going to do it on himself. I am going to support only the legs. Just slowly get up. So ensure that the pillow is in between the legs. So until he gets out of the bed, pillow in between is very, very essential to avoid adduction and internal rotation. So what is adduction is like bringing legs closer, that is adduction, and there should not be any rotation, that is like leg in or out, that should not be happen, which is a risky position for the operated side. So for the ball and socket, for the new ball and socket to get fit, to get set, so these are the movements strictly prohibited. So now I am going to show how to make the patient walk after THR, that is total hip replacement. So I have given the assistive aid walker. So I am also going to support him from the surgical side, that is right side. Operated side is right side, so I am going to stand beside. Now I have instructed him to place the walker first, then the operated side, that is right, followed by left. So he is going to get up, walker, right side and left. Now he is going to turn towards the sound side, which is always advisable. Right side and left. So we have to ensure that he is within the walking frame. We have seen the exercises which are supposed to be done in the first few weeks, that is 1 to 4 weeks. So now next week exercise protocol that is supposed to be done along with the previous exercises. So this is again a follow up, but in the further weeks, that is 4 to 6 weeks. He is going to demonstrate how to work on the surgical side abductors, that is to work on the operated side outer thigh muscles. We have to lift the sound side leg, that is the actual function of the muscle. Now start. This is hip hike. As he do, we may think he is working on the sound side. It is not that. To lift the opposite leg, we need to use the operated side outer thigh muscle. So this is for the abductors. To work on the abductors, to strengthen the hip abductors of the surgical side, we have to lift the sound side, that is good leg. The next exercise is again to work on the hip abductors, because to walk we need adequate hip and knee flexion range. Also we need to strengthen the hip abductors for balanced walking. Now he is going to show side leg raise. Yes. 1, 2, 3, 4 and 5. Good. So I have shown you the week based protocol, that is rehab program. So after the surgery, after this hip replacement, so we have to follow 6 weeks strict protocol for the better improvement. So to avoid re-injury, to follow the correct pattern of walk, for the better functional strength. So this rehab protocol will be definitely useful, and I am also going to finish the episode with some do's and don'ts. So as I have shown here, like the knees should not cross over, should not touch each other, and there should be no rotation in the hip till he gets up from the bed. So the knees should not touch, and while sitting in the bed, the knee we should not bend forward beyond 90 degrees, which is not advisable. Even in chair sitting, if we have to pick up something, no forward bending is advised after the surgery, and cross leg sitting and floor sitting will take its own time, so it is not immediately possible. And thank you for watching us. Keep watching Fit with Mithraas. For more videos, please subscribe. Thank you.